Hi, everyone. Did you know that February is Heart Health Month? And how did it get to be Heart Health Month in the first place? Well, back in 1964, Lyndon B. Johnson was the first one to declare Heart Health Month. That was 56 years ago because he was the first president to suffer a heart attack, and that really got the attention of the nation about how serious is cardiovascular disease. So today, we have a very special guest with us here today. By the way, I'm Dr. Mark LeMay, and we have Shelise Irby here with us today. And she is basically a registered dietitian and has experience in evaluating patients for cardiovascular issues and working with patients taking heart medications for the past 8 years. She comes from a family of chiropractors and has learned how to take care of her own health from a very young age. So help me welcome Shelise Irby. How you doing, Shelise?
Great, Dr. LeMay. Thank you for having me.
Great having you here today. So just tell us a little bit about the difference between a registered dietitian and a nutritionist.
I can definitely do that. That's a good question. So it might be a little confusing, but all registered dietitians are nutritionists, but not all nutritionists are registered dietitians. So dietitians have a very specific educational program they have to go through, which is a bachelor's degree in nutrition, a year-long internship at a hospital, and then a national boards exam that we have to take to get our license. And so very similar to a nurse. And the idea is that dietitians are the only nutritionists qualified to work in hospital settings, as well as provide medical nutrition therapy. So they're kind of like the, MDs of the nutrition world in regards to taking care of people from a nutritional perspective.
You also have to take continuing education all the time too, correct?
Correct. In order to maintain my license, just like a chiropractor, I have to do continuing education. Mm-hmm.
Great.
Yeah.
What kind of got you really interested in doing like the heart sound recorder?
So the heart sound recorder is a non-invasive mechanical device. It's a microphone that I use to listen to the heart. And it's something that I learned about a few years ago through some work that I was doing with a supplement company. And I was very interested in it mainly because heart health is one of those situations, in my opinion, that we don't get a lot of heads up as an individual on how our heart is doing. Typically, we don't know there's a problem with our heart until after we've had some sort of myocardial infarction, like some sort of situation where we're ending up in the hospital or there's some serious problems like very high blood pressure, things like that. So I was really interested in it as more of a wellness tool to kind of determine how is the heart doing from a very non-invasive way, so that we can support it before we get to the place that we're having some sort of serious catastrophe and we're winding up very sick and maybe even dead,
Correct. And just so for everybody out there to understand that, Shelise Irby has been working with us in our office for the past 3 years doing heart sound recorder testing in our office. And it's been a great blessing for us and our patients. And I know next time we get together here, we're going to be talking about the next topic. So you want to tell them a little bit about what we're going to talk about next time?
Yeah, I'd love to. So for the month of February, Dr. LeMay and I decided to do a little video series to help support people's information about what their choices are in regards to evaluating their heart health, and also just to bring awareness. As Dr. LeMay said, cardiovascular disease is the number one killer, and it has been for the past 56 years for Americans. So this is a lifestyle disease. You might have some family history that's contributing, but this is definitely controllable by your lifestyle choices. And so both of our jobs is to help any patients that come into Dr. LeMay's office to make better decisions about their health with more information, right? So coming up, we have more information, which is next week we're doing nutrition's influence on the heart and medication-induced nutrient deficiencies. The week after that, we're doing what is the heart sound recorder and what's it testing? After that, we have symptoms of heart stress, men versus women. It can be very different when we're trying to determine heart health in females versus males. And then lastly, we're going to have a testimonial or two about people who have had the heart sound recorder test done on them and what their experience is. So lots of cool stuff coming up for the month of February, and I'm excited to do it. Oh, and if you're a little impatient, like I usually am, and want a sneak peek of what the heart sound recorder looks like, then there's actually a video that Dr. LeMay and I recorded a few years ago about how the heart sound recorder works live in person. I did a recording on Dr. LeMay, and it was a really short informational video, about 10 minutes long. We'll be talking more about it this month, but that's a great way to learn about it ahead of time.
And I'll put that in the comment section down below so everybody can take a look at that ahead of time. So
perfect.
Thank you, Shelise, for being with us. Looking forward to seeing you next week.
Thank you. See you then.
All right. See you then.